On March 27th, Congress passed a third measure to help Americans and U.S. businesses manage through the COVID-19 outbreak. Known as the Coronavirus Aid, Relief, and Economic Security, or CARES Act, this sweeping legislation provides payroll and operating expense support for small businesses. On today's episode of the AUA Inside Tract Podcast, we're joined by Dr. Mark Fallick. He's the chair-elect of the AUA's Legislative Affairs Committee. Dr. Fallick, welcome to the AUA Inside Tract Podcast, and please tell us about how the COVID-19 situation in New Jersey is shaping out right now.
You know, the situation in New Jersey, just like many other parts of the country, is alarming, and the number of cases that we're seeing continues to climb in New Jersey. The most recent numbers that I've seen are close to 19,000 cases statewide. The death toll is over 265. I believe the latest number I saw was 267 deaths in the state of New Jersey. And what we're seeing in the state is that in the north part of the state, which is very close to New York City, the number of cases are larger than where I am in the southern part of the state. But unfortunately, we're seeing a significant increase percentage-wise in the cases, alarming numbers of over 300%, over 600% from last week in terms of the number of cases and the death toll as well. So it's unfortunately something that, like many parts of the country, is continuing to become more and more of an issue each day. And I don't think we're anywhere near the peak of the surge, unfortunately.
And as you balance being both a business in the community and a healthcare provider, what steps have you guys taken to keep the doors open?
Yeah, it's been a huge effort on the part of our practice and many practices elsewhere. And everything I've been reading is talking about the impact this is having on medical practices. You know, independent medical practices are really having a tough time to stay open and be able to provide care to their patients. I've read numerous articles and heard from a number of colleagues about offices that are completely closing and facilities, independent practices that are not able to, provide care. In our practice, we've had to make some changes. We've temporarily closed some of our smaller satellite offices to try to consolidate care. We've had to, unfortunately, furlough some of our staff and cut back working hours of some of the other staff. And we're not unique in that situation. Everything I'm seeing is talking about medical practices throughout the country that are really in a tough place. They have for the costs of their rent and their expenses and their staff salaries. We're all obviously in this to try to help our patients, and that's our number one priority. And so we've had to make a number of changes. We've cut back all non-essential and elective visits and procedures. Certainly a number of things that we do as urologists that are not considered emergent or urgent, we've had to put on hold. Care, patients who want vasectomies and other procedures that aren't essential right now are going to have to wait, unfortunately. What we are seeing is that we're limiting visits and elective surgery. We've had to temporarily close our lithotripsy center. Our surgery center is cutting back and only doing emergent or urgent type cases where, if we had to wait, it would potentially have a negative impact on the patient's health or outcome. But that's mean reduced hours, reduced staff, scheduling issues. So it's having an impact in a number of different ways in terms of how we function. One of the other things that's been great is that the AUA, American Urological Association, has really been a big proponent for a long time about the ability to provide care via telemedicine and telehealth. It's been one of the legislative priorities for the Legislative Affairs Committee for quite a while. We've had an active telemedicine work group in the Public Policy Council. And fortunately, that's allowed many urologists to switch over and begin providing telemedicine care to our patients in a manner that we can limit face-to-face interaction to only those that really need it.
Are you finding that with telemedicine, you're adapting quickly as the rules change?
Yeah, the telemedicine ability is something, as you mentioned, where some of the requirements are changing day to day. I know there was a previous podcast with Dr. Rubenstein that addressed some of these issues. I think that, it's certainly a great option for those patients that don't need an in-person exam or in-person procedure. So established patients were able to see, follow up on lab results, make a follow-up plan about monitoring kidney stones or blood test results, PSA results. The regulations, as you alluded to, are changing regularly and changing day to day. So it's challenging to keep up with that. I think the AUA has been doing a great job providing podcasts, providing updates on their website. We're getting information from other organizations as well regarding, how to comply. We know that for Medicare patients, some of the rules and restrictions have been eased during this crisis, and that's really nice in terms of patients being able to use telemedicine from their home, which they previously couldn't do. The consent form process and the HIPAA process being potentially not as strict as it had been. There's still challenges with telemedicine. We don't know yet what reimbursement's going to be from a lot of the non-Medicare providers, the insurance plans and the private insurance plans and some of the state plans. Still remains to be determined how we're going to get reimbursed for the telemedicine visits. But the ability to be able to care for our patients without putting them at risk, without putting our staff at risk, without putting ourselves at risk of exposure to the disease unnecessarily has been really a nice skill to be able to have.
Dr. Fallick, how has the coronavirus concerns and this pandemic impacted patient care for you?
It's been a real challenge, Casey, to try to determine what can safely wait and what needs to be taken care of more urgently or emergently. I mean, clearly there are some things that we want to hold off on doing right now so that we don't utilize medical resources unnecessarily and God forbid avoid complications that would send a patient to the emergency room unnecessarily and take away from their ability there to provide other care. So certainly elective things that like vasectomies, like penile prosthesis implants, like varicocele surgery, those are things that can wait. There are other things that clearly can't wait, and significant cancer surgery will need to be done. That being said, there are some things that have changed with that. I just heard from one of my hospital systems last night that all laparoscopic and robotic surgery has been put on hold, and so anything that has to be done that way is going to have to wait. It's been helpful. The American Urological Association has given some guidelines. American College of Surgeons has published a list of acuity for surgery, and there's basically 3 tiers. Tier 1, which is elective and can be postponed. Tier 2, which is sort of intermediate, and Tier 3, which is a high acuity and includes cancers and probably acute trauma issues, things like that. What's really challenging for us is dealing with some of the in-betweens. So you have a patient with some small bladder tumors. Can that wait? And if so, for how long? You have a patient with ureteral stents in place for an obstructing ureteral stone that were put in prior to the COVID-19 explosion of case incidents. And so if a patient's really, not tolerating their stent well, or they've had a stent in for a while, that probably, needs to be addressed in a sooner fashion. Certainly non-obstructing kidney stones, and elective lithotripsy falls into the tier 1 that can be held off on. And even some of the cancer situations, I think, need to have the physician input as to how significant is this or not. Is a small prostate cancer something that can wait a few months to be treated, or will that put the patient at risk? So these are challenges that as physicians we are dealing with day to day to try to assess with our patients what's safe to not do right now and what needs to be done right now, and taking into account the desire to minimize, unnecessary contact with others, and also to make sure we're not utilizing precious healthcare resources that might be needed for other more critical patients.
Do you have anything you'd like to tell us about the CARES Act and how that may be impacting things for you in the future?
Yeah, this is some regulations that, as some of these other things have been changing rapidly, and in fact, I believe there was a clarification or update from CMS yesterday that's still being evaluated to figure out how it's going to help and impact urology practices. But the ability for many practices to get small business loans to help with payroll and expense issues for the practices is something that's hopefully going to help a lot of practices sustain some of the economic impact of this crisis. I think that what's interesting for a large group like us is that there was some initial concern that because of the 500 employee rule that is in place for the small business loans, that some of the larger independent practices may actually not qualify. But I did see a clarification that I think still needs to be determined whether it will apply or not, but that if each location of a practice or each location of a business has fewer than 500 employees, they may still qualify. So hopefully that even some of the larger independent practices like ours will still be able to take some of these government-provided economic supports and be able to use them to sustain our ability to stay open and provide care for our patients.
Do you have anything else you want to discuss with us?
Well, I think that these are, very challenging times for everyone. And I think that, the key is obviously following the guidelines to make it, less likely that people are going to be impacted by the COVID-19 disease. And I think that anything we can do to keep our patients healthy, keep them out of the emergency room and out of the hospital is beneficial. And that's why I think it's important that we continue to be able to provide care as best we can through our independent practices. We continue to be able to provide urgent and emergent type surgeries in surgery centers so that patients don't have to utilize the resources at the hospital that are otherwise needed for patients with the COVID-19 disease. I think that, these are challenging times for everyone. Healthcare providers are, obviously committed to keeping our patients well, keeping our patients healthy, trying to avoid any unnecessary interactions that might increase risk of spreading the disease, while at the same time providing the needed care that our patients need and keeping our practices viable so that in the future, patients continue to get the urologic and healthcare that they need.
Dr. Mark Fallick is a urologist with New Jersey Urology, and he's been our guest today on the AUA Inside Tract Podcast. Thanks for joining us, Dr. Fallick.
Thanks for having me, Casey, and I hope you and everyone stays well.